Greetings to all of you from across the globe. My name is Dr. Josephine Okwera. I'm the Director for Health and Social Services at Uganda Red Cross Society. Uganda is home to more than 18,700 species of flora and fauna, including 53% of the world's mountain gorillas and 11% of the world's bird species. Uganda has a population of 40 million people, with about 66 of that population engaged in agriculture, out of which 58% were in agriculture, are also involved in livestock farming. The One Health concept is about 5 years old in Uganda, having been launched in 2016, where the National One Health platform to spearhead collaborative efforts among 4 government sectors. That is the Ministry of Health, Ministry of Agriculture, Animal Industry and Fisheries, Ministry of Water and Environment, and the Wildlife Authority was launched. The One Health Technical Working Group was also formed, and URCS is a member of this technical working group, besides other non-government organizations like the UN agencies, the US government agencies, academia, veterinary and medical associations, and research institutes, among others. Uganda Red Cross Society is a membership organization which was incorporated by an Act of Parliament in 1964 to be auxiliary to government in implementing life-saving interventions. We have a broad network of 51 branches and over 430,000 members. And these are community-based volunteers that enable us to provide last-mile interventions across the country. Our programming focuses on disaster risk management, health, WASH, livelihood, and climate change adaptation using all of society and community engagement and accountability approach. We focus on building the capacity of the community to prevent, detect, respond, and recover from disasters and disease outbreaks using the community-based surveillance model and the community engagement and accountability approach. The foundation of our community-based surveillance program, where most investment is put, is on community health promotion and risk reduction. We also support preparedness and response to outbreaks. Community-based surveillance is conducted by trained community members who are Red Cross volunteers. They are trained to identify signs and symptoms of epidemic-prone diseases, and once an alert is identified, the volunteer reports to the surveillance team and reacts appropriately with relevant information on control measures and first aid if needed. Interventions are conducted not only for humans, but also for the animal health and environmental health. Our volunteers support surveillance and mobilize their communities to vaccinate their domestic animals. We also have volunteers who support their communities to create awareness on environmental issues and also to improve sanitation. Our community engagement and accountability approach includes community participation and feedback mechanisms, providing correct and timely information, social and behavior change communication, and advocacy. We believe that when we meaningfully engage the communities and are accountable to them, it builds trust, making it easier for them to accept our interventions that can empower them and lead to resilience. So how does URCS meaningfully engage the community in its interventions? As a membership organization, we do have community members involved in URCS governance at central and branch levels. We also have volunteers who are community-based, who are trained to implement health interventions. We engage with the local civil societies and community-based organizations for collaborative implementation. We provide volunteers with the skills to be able to give information as aid to the last mile and to leave no one behind. We do social and behavior change communication activities, including the community dramas and mobile cinemas. Now, planetary health is an emerging concept defined as the health of human civilization and the state of the natural systems on which it depends. Planetary health calls urgent attention to the extensive degradation of our planet for human advancement. URCS is streamlining this concept in all programs by providing health literacy and other interventions that integrate communicable and non-communicable diseases, environmental awareness, and climate change adaptation. However, there are some challenges that we've experienced, and we do make certain recommendations. Human, animal, and environmental departments still work in silos, especially at the subnational and community levels. We recommend joint planning, budget, and a joint approach on digitalized surveillance systems, diagnosis, data sharing, and risk mitigation. There is shortage of trained human resources to implement an integrated program, so there is need for human resource development. The current achievements in Uganda have mainly been driven by external funding. Lack of emergency funds will result in delayed and slow response. We therefore recommend advocacy for government budget allocation, policies, and regulations. Community myths and misconceptions hinder progress towards the desired adaptations. This requires long-term investment to sustain community engagement and inclusion programs. Thank you for listening.